So we will start with Mr. Ozer, and we'll do 3 minutes, and any questions of the commissioners will not count toward the 3 minutes.
Okay, thank you, Judge Ecker. First, we're going to want to have established some relationship between the approval of the budget and the performance review. The performance review is going to determine whether or not the money is being spent appropriately and whether any funds are being diverted inappropriately. And we think that in terms of approving a budget, you'd want that information before you did so. Now, whether that means that you approve a budget for 4 months or 6 months or something like that, but you need the information from this performance review prior to the determination on the budget. On the audit, there's a couple of things that I think are pretty good, and that is that I think that Mr. Geeslin, who has reached out to me personally several times, has had a very positive impact on this process and has opened up a line of communication. And we have met with Matt Bull and Farzan Barucha, who is the Germain auditors, and we met, Mr. Lewis and I met extensively with them, and they seem attentive, capable, and competent. So that's good. The bad thing is that we heard in a meeting with the Germain auditors that Sendero had been taken out of the audit. Sendero is a huge number. We had $46 million that was lost. No one knows what happened to the money. The issues are pretty serious as to whether or not the rates that were established for the reimbursements were triple the Medicaid rates. There's issues of conflict. It appears that an attorney for Seton may have been serving on the Sendero board at the time the reimbursement rates were determined. And we haven't had this thing. We tried to get this thing reviewed, looked at through the county attorney's office. We haven't had any kind of cooperation on that, and they didn't even, to our knowledge, advise all of the board members, and they certainly, Mr. Geeslin wasn't aware of what we had sent, and I've provided all that information to you. We wanted a scope of review on this thing that was broad and deep, and we wanted an independent, credible audit. And we just don't see any reason for taking an issue like Sendero and pulling it out of the audit. We have submitted extensive requests to be determined in the audit. I think the Germain auditors are capable of looking at all these issues. And there has to be some kind of process, and you said that we could come back to you, determined so that we can make sure that the audit is going to be full, deep, credible, and independent, and that there aren't going to be things pulled out that may be controversial.
Thank you, Mr. Ozer. And we can get our own, is Nikki available? Is Nikki in the audience? We can follow up, get follow-up comments with regard to our own auditor's investigation, as well as the Ashley and Associates audit that's underway currently. Mr. Lewis?
Yes. I have two documents I've provided to you. One talks about the types of provisions that you can require in the financial controls and the record keeping of Central Health. And you can make that part of their budget process so that you have good government transparency and accountability. There are standard provisions. One, that their money be spent in compliance with the law, in particular Chapter 281 and 61, the Health Safety Code. Second, that its providers provide the types of standard service and performance-based records so that you can figure out whether or not they've spent the money wisely and the providers have spent their money wisely. And lastly, that they be required to use best practices to allocate their funds when they go to a joint project which is being used by the poor and non-poor. which is, of course, standard practice. You don't pay for something that you aren't authorized to pay for. And you can read the history there. I also have a one-page document with some backup. It's been very difficult to get information out of the UT Dell Medical School, but after 3 or 4 public information acts, I've gotten some information. I'd like to highlight the third one. We now know that about 84% of all Dell salaries and compensation are paid for with Central Health dollars, and we know it pays for Dell's business affairs officers, their development officers, their communications, their admissions, the dean's office, administrative personnel. It's hard to understand how that benefits the poor. The other thing is that we know that Dell uses the funds as a slush fund, and I quote from one of their exhibits. This assumes all compensation will be charged to Central Health less amounts received for clinical and research activity. In other words, anything they can't pay for from someone else, they pay for with Central Health dollars, whether it's related to health care or anything else. Fifth one is, I have asked repeatedly, 3 or 4 times, for documentation of the clinical services they provided. I can only document $2.9 million in healthcare services out of $105 million. Let me say it's probably bigger than that. It may be $5 million because they produced no documentation of how much money they spent for the Women's Health Project. These are their documents. They told me that they were the latest documents. They're supposed to produce them under oath, subject to criminal penalty. The thing that's important, though, is the future. Do you all know how they're going to spend the money over at Dell in the next 2 years? Well, they're going to spend $94 million of CH funds on care transformation and care delivery. It's going to be used for the entire community, not just the poor. There is no known allocation agreement about why Central Health taxpayers' dollars should go to pay for just the poor. And I want to finish this because this giveaway bothers me. Dell is using Central Health's money to pay for $15 million worth of modeling, which they claim is proprietary. But the taxpayers of Central Health don't have any ownership interest in that I'm aware of. So we've just given them their modeling and the proprietary information. And last, after we pay for all this infrastructure, much of which does not benefit the poor, they're going to charge us 1.3 times the cost for providing Central Health's patients their services. And let me say this, because I don't want to be misquoted. I'm an old and tired lawyer. I do not have all their documents. I've gotten what I could, but I can smell a rat when I see one.